time, Medicare annual enrollment kicks off here shortly in October. Ben Keel, the Vice President at UnitedHealth Medicare and Retirement, joins us. Good morning to you, Ben. So we want to start with, when can people actually enroll for a Medicare plan?
Yeah, great question. Like a lot of things in life, timing is everything. The first time most people have access to Medicare is when they turn 65. Now, what you may not know is you've got 7 months to enroll around your birthday. You've got the 3 months before your birthday, the month of your birthday, and then 3 months after your birthday. So you can enroll anytime in that period. My pro tip for all of you out there would be to do it earlier in that time frame, just to make sure you don't have any gaps in your coverage or incur any late penalty fees. So do it early, don't procrastinate. The second time that most people can make changes to their Medicare plan is actually coming up. October 15th through December 7th is the thing called annual enrollment period, where people can make changes to their plans. Always a good time of year to make sure that your plan's working for you like it should. And then the last one that maybe not as well known is if you have a qualifying life event. You can also make changes to your healthcare plan. The best example I like to use for that is when people move.
Okay, yeah, great information. I think, right, like being prepared and really doing things like this.
Absolutely.
But, I was reading here that more than 10,000 Americans are turning 65 each day. So newly getting acquainted with Medicare, it can seem really daunting and overwhelming. There's Plan A, there's Plan B. Can you help us out with that?
Yeah, A, B, C, D, E, F, G, you don't go back to grade school, right? So let me start with A and B, right? And that simply is called Original Medicare. That is what the government provides, right? So Part A covers things like inpatient care, hospice care, skilled nursing care. So that's A. And then B is more your everyday healthcare, right? So going to your primary care doctor, going to get preventative care, outpatient services. So those two things together, A and B, make up Original Medicare. Government provides that. So that's a start. Part C is also more well known as Medicare Advantage, right? And Medicare Advantage plans take Part A and Part B, they put it together into one plan, and then it's also run through a private health insurance company. So it's not run by the government, run by an insurance company. And what you get is things that aren't covered by Original Medicare. So you get prescription drug coverage, you get things like dental and vision coverage. For my mom who loves to go to the gym, you could even get free gym access. So you get a few more benefits and coverage aspects with Medicare Advantage. And then finally, Part D is probably the easiest to remember because D stands for drugs. So Part D plans are just standalone prescription drug plans. Now, there is one more plan that doesn't have a letter associated with it, and that's Medicare Supplement. That just works alongside Original Medicare and covers copays, coinsurance, deductibles that aren't covered by Original Medicare. Hopefully that helps.
Yeah, there's a lot there, and it sounds like a wonderful thing. But, someone's listening to all this and saying, that was a lot. I'm really excited about this now. But what are the most important things to consider when enrolling on a Medicare plan?
Yeah, in my experience and in talking to a lot of our members, you can consider a lot, and there's a lot to consider, but these are the three most important, I think, to start with. One is the budget implications of your plan, right? So many people look at the premium, what you pay every month for your insurance, and that's important. But equally as important is what it costs to use your plan. So copays, co-insurance, deductibles, things like that. So budget and does it work for you is sort of one. Number two is the network or your doctors, right? Most people want to go see the doctors they're already seeing. They don't want to change. And so making sure that your doctors or the health system that you like to go to is part of that network, also really important. And then the third one would be prescription drugs, right? So many people have prescription drugs that cost a lot. You want to make sure that the drugs that you're using are on the approved drug list or the formulary. Now, another pro tip, formularies can change. And so if you already have drug coverage, it's always a good idea to make sure that you check that every year so that you don't have a surprise come January 1st. So make sure that you're checking your drugs each and every year.
Ben Keel, you explained this all very well, something that can be very complex and confusing to a lot of people. You broke it down and really made it understandable for all of us. But how can people find out more about Medicare?
Yeah, I think for a lot of people, just talking to somebody is a place to start. So finding a local community event that are going on this time of year, speaking to a local agent's a great place to start. There's a great website called gettoknowmedicare.com. Again, that's gettoknowmedicare.com, where you can go and find a webinar, find those local agents. But there's also a lot of great videos organized that take this complicated topic, but break it down into really plain English to make sure that you're informed before you make this important decision. So gettoknowmedicare.com is a great place to start.
Okay. Ben Keel, thank you so much for all this great information today.
My pleasure. Thanks for having me.